right, welcome everyone. So if you are brand new, and extra welcome to you. This is something that we do every month with MS Visa News. I partner with MS Visa News to offer this support group where we share physical therapy-based exercises and education to help you know what you need to do to feel stronger and move better and easier throughout your day. And our supporter is Viatris, so a huge thank you to them for allowing us to do this. So today's topic is core and posture. I love talking about this topic because core and posture have everything to do not just with improved mobility, but I'll get into some specifics once I share my slides, but also improved bowel and bladder function, improved balance. So much of our daily activities can feel easier and better if we have a stronger core. So we're going to go ahead and dive right in. If you don't know who I am, I'm Dr. Gretchen. I'm a physical therapist and a multiple sclerosis certified specialist, focusing on functional based exercises and neuroplasticity concepts and strategies, because that is what we know from research, the best way for someone with MS to actually get stronger and walk better and improve your ease of daily activities. So that's what you learn about here on our support group calls. If you're tuning in live, you can say hello in the chat and let me know where you're tuning in from. And I'm just going to go ahead and get started. So I'm going to share my screen with you guys. All right, so again, we are touching on posture and core. So we're just going to discuss some core basics because it's important that you know what we're talking about when we say core. I never like to assume that people know what the core is, because so often when I was working in person with my physical therapy patients, I would say, okay, tighten your core, or we're going to do some core strengthening exercises. And they'd give me this blank stare where I could just tell that they had no idea what I was talking about. And using phrases like tighten your core, activate your core, to me it made sense, but to them it was gibberish. And so I always like to learn from that lesson and not assume that everyone knows what the core is. So we're going to review core basics. We're also going to review posture and what posture means versus core. We're going to do some exercises for both. And I have two products that are often brought to my attention whenever I'm talking to my patients about posture and core. There's two questions that I get asked, like, oh, will this product help or will this product help? And I have strong thoughts on them and want you to know what those are in case you're thinking about using them, or maybe you're currently using them. So I'm going to touch on what those two are, and then we'll wrap it up. And if you have questions at all throughout this discussion, please feel free to just type that in the chat and ask away. Okay, next slide. Let me open the questions box in case anything comes in. Okay. All right, so why is the core important? We all know inherently that having a strong core is important, but why? So it's because having a strong core in the center of our body can make mobility easier. And mobility, I mean that in all sense of the word, not just walking, but also transferring from one surface to another, scooting forward, scooting backwards, reaching down to pick up the dog food bowl, or reaching forward to grab a plate out of the cupboard. Any type of mobility that we need throughout our day can feel easier and more stable when we have a stronger core. Additionally, better balance and stability. So that includes when we're walking and when we're reaching for different things. It also includes balance and stability when standing up and sitting down. It can reduce low back pain. 90% of the time that I work with patients who have MS and or not MS that have low back pain, I'll teach them some of the same exercises that you're going to do today, or at least that you'll learn today. And just from implementing those core exercises, their back pain significantly reduces. So I think that just goes to show that a stronger core can directly reduce low back pain. It can improve your breathing. If we all right now, if you slouch, like your worst posture, and you try to take a deep breath in, feel how much air you get in your chest, and then let it go. And now fix your posture, your best posture, and now try to take in a deep breath and then let it go. For most of us, you should feel like you can get more air in when you're in a better posture, and all you did was sit up tall and improve that posture of your core. So improved breathing can be hugely beneficial. I actually worked with a patient about a month ago who was telling me that her breathing was feeling more labored. And so we worked on core and posture exercises, again, the same ones we're going to review today. And 5 days later, she texted me saying, "Hey, Dr. Gretchen, just wanted to let you know my breathing is already better just from doing those exercises." So breathing is huge. And then last but not least, improved bowel and bladder control. This is something that a lot of people don't talk about, and we often don't think that our core strength even affects our bowel or bladder function, but it absolutely does. I also see Joe says hi from Ohio. Rhonda says hi from Waterloo. Welcome, welcome. Okay, so what is the core? Again, I never want to assume that people are aware of exactly what the core is. And to be honest, most people don't realize that it's actually 4 different things. It's our abdominals, which is the one that most people think of, but it's also our side muscles, our back muscles, and our hip muscles. It's all of those. And the reason it's important to know this is because you might have good strength in one of these areas, or maybe 2 or 3. But if at least one of these areas doesn't have the appropriate strength, it can mean that walking is harder. Mobility in general is harder. You're feeling more off balance. It's important to have strength in all of these areas. And funnily enough, for a lot of my patients that prior to being an MS specialized physical therapist, a lot of my patients that would come to me didn't have MS, but they had back pain, and they were often athletes, and they were strong. They had great muscles. Several of them probably had 6-pack abs, but they still had low back pain. And so we'd work on some of these other muscles, the hip strengthening, the back strengthening, the side strengthening. And just from focusing on those, they actually saw significant reduction in back pain. Not only that, one of the abdominal exercises that we're going to do today can be the key muscle to have strength in to reduce that low back pain. Even my patients who likely had the 6-pack abs and were athletes and strong, even those people, I would teach them this one exercise, the bracing exercise that we'll do in a bit together. And just from teaching them that exercise alone, they noticed reduced pain in their lower back. So the core is all of this, whether it's pain or lack of balance, lack of mobility. Having strength in all 4 of these areas can make a big difference. What is posture? Because posture plays into this as well. Posture means holding your body erect against gravity in sitting, standing, or walking. And there's 2 different types of posture. Static posture, which is what I'm doing right now, where I'm sitting up tall away from the back of my chair, but I'm just I'm staying put. I'm not really moving. Whereas dynamic posture would mean keeping your erect posture while moving. So while walking, while bending down, keeping that good form. So what is posture? Posture requires strength and flexibility in lots of different muscle groups: neck, shoulder, abdominals, back, and hips. And I'm going to stop sharing my screen in a second here so that I can give you some examples on how to use both strength and flexibility to improve posture. When we're talking about posture, it almost always requires both a strengthening approach and a flexibility approach. And not only that, but it often is required on opposite muscle groups. So I'm going to show you what I mean. So when we're thinking about posture, when I say good posture or your best posture, I really want us focusing on a neutral spine. So often when we try to have good posture, we actually overextend. So if you see person D right here seated, this is too arched. A lot of us will just come up into our tallest position, arch our back, and this is too arched. This actually is not the ideal posture. This C is a neutral posture, or F is a neutral posture. So we don't want to be too arched. We don't want to be too slouched. We want to be somewhere in the middle. And I want to show you, I want to show you what that looks like just with me being a little bit bigger for you. So what I mean by having good posture is by picturing, so you're sitting right now, right? I want you to picture you being a puppet and you have some strings on your body and you have a string on the top of your head and someone pulls that string to get you to be even taller. Oftentimes when I think about posture in this way, it prevents me from overarching my back. If I'm just thinking of getting as tall as I can be by arching my back, I'll often sit up like this, and that's way too arched. I actually want to be more like this. And if I think of that string and pulling myself up, it gets me into a better posture and a better technique. So that's one thing that you can think about. But I want to show you two of the most common postural difficulties, I guess we'll say, that my patients with MS struggle with, and how you can use that strength and stretch approach to improving your posture. So I'm going to back up and we'll do a little demonstration here. Take a sip of water. Okay. So for the sake of this demonstration, I'm not going to use a mobility aid because I want you to be able to see what I'm doing. With that said, this everything I say applies even if you're using a mobility aid. Okay, so posture number one that tends to happen when we're sitting or standing or walking is this really rounded posture. So if you're sitting, it might look like this. If you're standing, it's this. If you're walking, it's this. So when that happens, the front of our body, the front of our chest often is too tight and it rounds forward. So we need to stretch out the front pec area. If we can stretch out these muscles, the more likely we'll be to come up tall. Tightness always wins. So even if you have full strength in the appropriate places, if you have tightness here, you won't be able to use the strength that you have because it'll pull you down here. So you need to stretch these out. My favorite way to do this, seated or standing, is to find a surface like a wall, a chair, a doorway is great, and you're going to put your hand on the wall and then rotate away. So I'll show you how to do it seated too, but you should feel the stretch in the front of your pectoral muscle, the front of your shoulder. If you're sitting, it might look like this. So you're holding onto something and you're turning, and you should feel it somewhere in the front of your muscles. If you have a doorway available, you can stand in a staggered stance, put your hands on the doorway, and then lean through, and you should feel it on both sides at the same time. And of course, you can just do one side or the other. But that's my favorite way to get a good pec stretch. Now, that's only part of the equation. We talked about stretching and strengthening. So if this is your posture, in seated, standing, or walking, you want to stretch here and strengthen the opposite side, which is your back muscles. So we stretched these muscles out. Now we want to strengthen those muscles in our upper back. My favorite way to do this, you can do it seated or standing, is to sit up tall, your best posture. Hands are palms facing up, elbows in by your side, and you're going to squeeze your shoulders back and down, and then relax, and then squeeze back and down. And I want you to be squeezing your shoulder blades together, almost like you're trying to squeeze a pencil. And I want you to allow your shoulder blades to fall down as well. almost like you're trying to get your shoulder blades to fall into your back pockets if you were wearing jeans. I find that if I don't instruct my patients to draw your shoulder blades down, then you might squeeze together, but also come up. And we don't want to come up. We want to keep our shoulders away. So you would squeeze, hold for a few seconds, and relax. And you would do several repetitions of that. That combo of stretching the front and strengthening the back can often be a huge game changer in breathing better and in having better posture from that rounded posture up to neutral. That's posture number one that is a high difficulty. The other difficulty with posture that my patients tend to have is not necessarily with their back. They're not rounded, but they're hinged. So this is more of a hip posture issue. So if you're hinging forward, again, with or without a mobility aid, this often means that these muscles, the front hip muscles, are tight. So we want to stretch those out. One of my favorite ways to do that is in a staggered stance and tuck your butt under. And you should feel a stretch on the front of the hip of the back leg. And then you would do the same thing on the other side. Like back, tuck under, feel the stretch here. You can hold on to a mobility aid or a surface if you need to, but that's a great standing stretch that you could do. You could do the same stretch sitting down, but it would look like this. So you look very similar to this standing, but you're just sitting on a chair. And then you would turn and tuck. So again, you're feeling that stretch in the front. Now with that forward posture, we discussed these muscles are tight, so we want to stretch those, but these muscles are weak, so we want to strengthen those. So just to give you a few ideas, to strengthen your glutes and hamstrings, a simple standing exercise could just be standing up tall and squeeze your butt muscles and then relax. And then squeeze and your hips should come forward a bit and relax. And squeeze and relax. This is a great glute strengthening exercise. Another option, you could hold on to something for support as you bring one leg just diagonally back. You're not moving your upper body at all, it's just your leg going out. This is what it looks like from the side. If you want a seated option, my favorite seated option is feet together, knees together. Open your knees as wide as you can, then squeeze your glutes, then relax and close. Open, squeeze your butt muscles, relax and close. So you do several repetitions of that. That combo would stretch the front and strengthen the back and can lead to better posture of less hinging as you're sitting, standing, or walking. Okay, I'm gonna check the chat. Let me know if you have any questions so far. We're gonna move into core. Okay, so moving on to core. Core, as we've established, is the four areas: front, side, back, and glutes. And what you're going to be thinking about, ideally, after we have this conversation, is you should always be activating your core, not just when you're doing exercises. Of course, doing exercises to strengthen your core is amazing and definitely something that we'll be doing and discussing right now and that you should do on your own. But in addition to that, sorry for the dogs barking, in addition to that, you should be implementing your core throughout the day. So for example, before you get in and out of your car, you would engage your core through the exercises I'm about to teach you. Before getting in or out of bed, you would tighten your core. Maneuvering in your chair, before you scoot forward or scoot backward, you would tighten your core. Repositioning yourself to stand up, strengthening your core during your exercises, putting on shoes, socks, and pants. All these normal day-to-day activities should absolutely be a moment where before you do them, you tighten your core. Now, one thing to remember about that is it's challenging, right? Because you need the strength to do it, but then you also need the mindset, you need to remember to actually do it. And so I think it's a 2-in-1, having the strength, but remembering to do it and combining those. So we'll talk a bit more about that at the end too. Okay, so for the seated exercises, we already discussed the pectoral muscles, which also affects the neck and our posture, but I also want to go into some seated strengthening for our core. So these are going to be a few examples. So you can write them down if you want. Also, this is being recorded, so you can rewatch the recording, but I'm going to stop sharing my screen and we'll do these together if you want to do them with me. All right, so the first exercise was bracing. This is the #1 exercise. And for a lot of people, this is the only exercise that you need to do to strengthen your core to have the positive benefits of walking more stable, better bowel and bladder function, better breathing, less low back pain. It's that powerful of an exercise. So I'm going to show you what it is and then give it a try. If you want, we can discuss it further. But this one is for the front of your core, so it's for your abdominals, but it's specifically for the deepest abdominal muscle. So that muscle is called your transverse abdominis. You might have heard of other exercises called for the transverse abdominis or the TA. That's what bracing is. So what you're going to do is you're going to sit up tall, but towards the back of your chair. So you're sitting with good posture, but allow yourself to relax. For most of us, we have this arch in our back. One way that I like to think about activating our core is to think about flattening our back. So try to flatten that arch of your back into the chair, so that ideally no one would be able to come and fit any fingers through your low back in the chair. And then relax. And then push your low back into the chair and relax. You're trying to use your belly muscles to do this. It's a hard exercise to demonstrate because it's such a small movement. But again, you're trying to use your core to flatten your belly button and flatten your low back into the chair and then relax. Another way some people like to think of this is to use your ab muscles or belly muscles to pull your belly button in towards your spine. Another way people like to think about it is to pull your belly muscles and belly button in towards your spine and then up towards your nose. Another way people like to think about this is as if you're zipping up, if you're wearing jeans, but you're zipping up your belly muscles. So you start low and you tighten your belly muscles from lower and all the way up to about your mid-torso. So it doesn't matter how you think about doing it, but it matters that you find one way that resonates with you and where you'll know you're doing it correctly if you feel it below your belly button and horizontally. So anywhere lower is fair game. I also want to share with this exercise, it's very hard to do in itself, but it's especially hard to do if you've never done this before or if you haven't used this muscle in years, which if this is sounding new to you, you probably haven't used this muscle in, it wouldn't be crazy to say 10, 15, 20 years. So with that in mind, it can take a while for your body to actually activate those muscles. So you might understand what I'm saying, and you might be doing it, but you might be feeling nothing at all. And I just want you to know it can be normal to take anywhere from 4 to 6 weeks practicing this exercise without even feeling it before you have that thought of, oh, I think I'm doing it. I think this is what it was supposed to feel like. So even if you're trying it now and you don't feel it, keep doing it. It's still a really powerful exercise, even if right now you're not feeling it. Okay. Next exercise, I don't see any questions, so I think we're good. Next exercise, so that was for the front. Another exercise that we can do for more of the outer abdominal muscles up in the front is sitting and then sitting taller. So sitting relaxed, and then don't use your hands as you sit up tall. and then slowly relax and sit up tall. Slowly relax and sit up tall. If it's too easy, you can scoot more towards the edge of your chair so there's a bigger distance, and slowly relax. And then use your abdominal muscles, tighten those belly muscles, and then pull yourself up. If it's impossible to do that without using your hands, you absolutely can use your hands, but use them as lightly as possible. Try your best to mostly focus on using your belly muscles. So that's another one of my favorites. The next one, if we think about the core, we said it was the front of our muscles. The glutes, which we've already done with our standing exercise, or the seated one where we opened our knees. So we've worked on those. Another area was our side muscles. For the side muscles, I really like doing an exercise that I call the penguin, where you're sitting up tall in your neutral spine and you're tipping towards one side, and then you slowly come back up. And then you tip over this way and slowly come back up. So we'll do a few of these, and I want to show you from the side. It's tipping directly to the side, not tipping forward. So often people will tip forward because they feel like they get closer to the ground and like they're more successful with the exercise because they can touch the ground or are getting closer. This exercise is not about touching the ground. It's only about tipping as far as your torso will let you and then coming up. And spoiler alert, if you haven't done this exercise ever or in a while, you might be sore tomorrow on your sides here. It's a common area to feel soreness in. So this is a great exercise for strengthening the sides of our core. Now, the last area that we discussed that's part of our core that we haven't touched on yet is our back. So I have two different ways that are very similar, but there is a difference, that I really like to do to strengthen the back. With both of them, keeping your back flat is key. So with the seated option, you're going to sit up tall in our neutral core posture, and you're going to hinge forward. Doesn't matter where your arms are, but you're keeping a flat back. So you're not rounding, you're keeping a flat back and hinge as far forward as you can go, and then slowly come back up to neutral, and then reach forward again, and then back. So this is exercise number one. The other exercise that's similar to this one is, I call it around the world because I don't know why it makes sense in my head. Your hands are still touching just like they were as you were moving forward, but you're going to keep your back flat as you come over to your right and then loop all the way over to your left and come back in. So we're going around the world. So you're reaching, back stays flat the whole time, and then coming up. And you would do it both directions. So this is a good back strengthening exercise as well. The last exercise that I want to show you uses our obliques. So we talked about the front, the side, the back, and our glutes. So you've got a few different exercises for those. But it's important that we also include rotation because our spine moves forward and backwards. So that would be flexing and extending. It also moves side to side, which we've done, but it also should twist. And if we don't twist, our spine can get very stiff. And the stiffer our spine is, the worse posture we'll have and the worse our core strength can be. So my favorite strengthening exercise for rotation is, again, not use your arms if possible, but you're gonna twist and rotate as far as you absolutely can. And then once you're as far as you can go, untwist and go in the other direction. And you're trying, twist, twist, twist. You're putting so much effort in to try to get your body to literally turn the other way around. Obviously, that's not going to happen, but the more you attempt to do that, the more you'll feel your muscles engage. Whereas if you're just loosely twisting to one side, then the other, and you're not putting a whole lot of extra effort in, you're just moving in your comfort zone, you're not using a whole lot of strength. But if you attempt to really turn, you will feel those muscles engage for rotation. So those are some of my favorite exercises that can help with core and posture. So I do have some other things I want to share with you though. So this is the slide we've seen before. I wanted to bring it back. So that bracing exercise was one of the first exercises that we did where we tightened our core, we flattened our low back into the back of our chair. And ideally, if you are feeling it correctly, it would be below your belly button, horizontally, somewhere down in that area. So a perfect example of when to use that specific exercise would be before all of these activities. So you would do that exercise as part of your core strengthening exercises, where maybe you would do 10 repetitions, maybe holding for 10 seconds each time, and you would do 2 or 3 sets of that every day, let's just say. But in addition to that, we also want to implement that into our daily life. So before I stand up, I'm going to brace and tighten my core muscles and then stand up. Before I sit down, I'm going to brace and then sit down. One thing that I've noticed a lot recently, my daughter is almost 9 months old and she is getting heavy. And so I think one thing that has been leading to some low back pain for me is putting her in and out of her car seat. And so what I've been doing is mentally focusing before I even lift the car seat. I think to myself, brace, tighten my core. Then I lift the car seat and put her in or take her out. And it significantly lessens my low back pain. And sometimes I don't even have low back pain at all because I tighten my core correctly before even doing it. So that's what this idea is. Before you get dressed, you tighten your core. Before you close a door, open a door, get out of the shower, in the shower, you would tighten your core. Now, that takes practice. It takes a long time, and it's unrealistic to think that you would remember every time to do that right away, to think about bracing and tightening and then doing it. So you don't have to aim for 100% of the time, but it can be really helpful to activate those muscles in daily situations, not just when you're strengthening. Okay. Bracing is different from cat-cow. Yes, and cat-cow versus Kegel. So cat-cow is, when you're doing it seated, is this exercise where you're really rounding. This, I think, this is the cat. And then this is the cow where you're extending. So this is more for spine mobility, which is a great exercise, but this is the cat-cow. And then bracing is when you're pushing your low back flat into the chair. And you would progress the bracing by, once this felt easier, then you would do it towards the edge of your chair. I'm only moving my hands up here so you can see what my belly is doing, but I'm still flattening that low back, using my belly muscles to flatten my back and relax, and then flatten and relax. Then you could progress to doing it standing, flatten and relax. You're bracing, you're tightening, and then relax and tighten. So again, it's such a small movement, but that's the difference between bracing and the cat-cow. And the Kegel exercises are more of a pelvic floor exercise that you can strengthen at the same time as your core, but it's a separate exercise. Good questions. Okay, so I just have the 2 products that I want to show you before we wrap up here. So this is one product, and if you've used this or if you've thought about purchasing it, let me know in the chat area. Okay, before I comment, I just saw Kevin say it's almost a pelvic tilt. Yes, it is almost a pelvic tilt, but it should feel different than a pelvic tilt. A pelvic tilt, you're using your hips for the movement more so than your abdominals. With bracing, It's an abdominal exercise. So it's a small differentiation, but with a pelvic tilt, the pelvis is what's moving, is what is initiating the movement. With bracing, it's your abdomen, it's your belly muscles that are initiating the movement. So your pelvis will tilt, but it's more of a focus on the muscle versus the pelvis. But good, you're on the right track though. Okay, so this is a back brace that a lot of people that I know that I've worked with in the PT clinic will purchase to, if you see this woman here, they use it to get into better posture. And I'll start off by saying some people use this and it's been really great for them, very helpful. But for the majority of people that I work with, it's not that helpful because it doesn't affect the strength or flexibility of your muscles. So oftentimes, if you are in poor posture due to tight muscles and weak muscles, you'll wear something like this and it might help for about 30 seconds or less, but then you feel pressure and discomfort right in the front of your pec areas where this woman is in the blue shirt. You'll feel discomfort there because you're still slouching, but you're just wearing this strap. And the reason for that is because you don't have the appropriate strength and flexibility to get up into proper posture and then maintaining that posture. So if you've used one of these and they've helped you, absolutely keep using it, keep going for it. But for the majority of people that I work with, this is not that helpful. You can use it in addition to your exercises, but it's absolutely not a replacement for them. And then the last thing I want to discuss in terms of products is upright walkers. Let me know if anyone has ever used these. So upright walkers is something like this where you either can just raise the height of the handles on the walker that you're using, or they actually have upright walkers. So many people that I work with who have poor posture want to use one of these. And I understand why. I want to show you in reality what actually happens when most people use these. I do know some people who have used these and they are helpful, which is great for you. Keep using them. But for most people, if you're hinging or rounded as you're walking and you get an upright walker, so your arms are more up here, what tends to happen is it might help your posture for about 30 seconds or less. But then when your muscles get fatigued and the tightness kicks in, you go back to your original posture of hinging or rounding, but your arms are just left up tall. So if you're someone who normally rounds and your normal walker might be here, and you get an upright walker, for the most people, all it really does is it brings your arms up, but your posture stays the same. Or if you're normally hinged, you're gonna end up with just your arms up here, but you're still hinging. So I'm not a huge fan of upright walkers because for most people, just raising your arms doesn't affect your walking, and in fact, it actually can cause more discomfort in your elbows and your wrists. And again, I never like to say never, you know, and they are helpful for some people, but any tool you use should always be in addition to your strengthening and stretching exercises. The time where you run into the biggest issues is when you become dependent on one of those products, and then your strength is just going to get weaker and weaker. Your flexibility is just going to get tighter and tighter. So it has to be used in combination with those things. So I just wanted to point that out. But at the end of the day, remembering to activate your core muscles, not just during your exercises, but also when moving, is the real game changer. You can have great strength when you're doing your core exercises, but if you're not implementing it throughout daily movements, you're not going to reap as much benefits as you would if you were implementing and activating throughout the day. So just remember that as well. Okay, so that's where my education ends. Let me see what questions you guys have. As always, you can reach me via email. If you're wondering what courses I have, ways to work with me, this is my website here. I have the Missing Link podcast a Facebook group, Instagram, YouTube. I've got all the different platforms to help share education on exercises and symptom management. And I always forget to put this on there, and my tree's covering it right now, but I also have a book called The Missing Link as well. Okay, so I see a question, will it help with arm pain? Were you referring to what were you referring to? I'm assuming it was one of the products, the upright walker or the brace. Let me know what you were thinking for that. The walker? I see you said yes, but I don't know. Okay, the upright walker. So will that help with arm pain? It depends where your pain is. In my experience, it can often make pain worse because it's at a different angle and it's at a more bent angle. Like your elbows are more bent when you're using an upright walker. And if you're putting a lot of weight through the walker on a bent joint, that can make the pain worse. So I would say for some people, it might help with arm pain because you're changing the angle, but I think for most people, it wouldn't necessarily help with that. And the best thing that you can do to help reduce arm pain when walking with a mobility aid is to practice balance exercises and weight shifting exercises. So you shift your body weight off of the mobility aid. Not 100%, you can still use it, but shifting your body weight from maybe using the mobility aid 80% to maybe only using it 50% or 40% or 30%. That's going to be the biggest help for upper body use of mobility aids. Still have elbow bursitis. Walker handles don't go to my wrist. They are too high. Yeah, so, and we have a whole presentation on this coming up in 2025, but the appropriate height of a rollator or a cane should be when you're standing up, the handles should hit your wrist bones, like the height of your wrist bones right here. So that's where you should start in terms of the appropriate height. If that then feels too unstable or off balance or unsafe, then you can adjust from there, but that's where you'd want to start. Arthritis from that, when arm is straight, it hurts. Or it says, have a Merry Christmas. You too. Terry says, thank you. Awesome. Any other questions, comments, thoughts on the exercises? I specifically chose these exercises today because my hope is that they're very easy for you to implement throughout the day. So many of them were seated. And the reason for that is because most of us sit throughout the day. So if we are sitting on our computer, maybe we can do our pecs or our upper back strengthening exercise at that time, or our hip flexor stretch, or the seated clamshell to strengthen our glutes. We can implement them throughout the day from our seated position. We don't even have to stand up to get those exercises in. So that's why I love seated exercises overall, but even for core strengthening. Julie says, Merry Christmas and Happy New Year. Yes, this is our last lecture, our last support group of 2025, which is so crazy, but we have monthly lectures, support groups coming up for 2025. Did I say 20? So our last one for 2024. I think I said the wrong year, but we do have monthly ones planned for 2025. The seated clamshell hurts. So for any of the exercises, if it hurts in a hurts so good kind of way, like, whoa, I haven't done this in a while, I can really feel that, that's okay. But if it's pain, then don't move as much. So don't open your knees as wide, or don't squeeze your glutes as much. So do put less effort in to ideally reduce and minimize any pain. If it's still uncomfortable, then don't do that exercise. If it's still painful, don't do that exercise, and you can choose a different one. No exercise should cause pain. All right, I don't see any coming in. So just so you know, for moving forward for 2025, we're keeping the same routine where we meet the second Monday of every month. So be on the lookout for that. I hope that you can tune in live. All of these are recorded, and so if you ever need the recordings, they are on MS Views and News YouTube channel, so you can catch those there. But I always love if you can join live, because I can tweak the program and answer your guys' questions based on the feedback that you guys are giving me, and make sure that you feel heard and like you're getting the most out of these support groups. Thank you. This was very helpful. Good. I'm glad. I'm so glad to hear that, Dion. Summer says, I always get so much out of these webinars. Thank you. Good. That makes me so happy. And we're also always open to ideas that you have. Every webinar and support group that we do, the topics come from you guys and what I've heard from you guys via this chat. So thank you for giving those. If you have additional ideas or things that you'd want us to focus on during any of them, just let me know and we can work those in throughout the year. Trying to remember that sitting is the new smoking. Yes. Yeah. And honestly, just simply standing is a phenomenal exercise that works your core really well. Just standing with good posture, whether that's for 5 seconds or 30 seconds or 5 minutes, whatever it is, just simply standing is a great, great exercise for our core. It uses all of our muscles. If any muscle turns off, that's when we'll start slouching or hinging or leaning. So standing that should have been another one I included today. It's such a good one. Happy holidays to you and your growing family. Thank you, Kevin. Robert says Merry Christmas and Happy New Year, Dr. G. Thank you. Yes, Merry Christmas, Happy Holidays, and Happy New Year. I will see everyone in the new year. Thanks for tuning in. Bye, everyone.